Hi, a very good day to everyone. My name is Renisha and my group members are Kausalya, Darshni and Yin. Today we are going to be presenting on Microsoft Teams. Microsoft Teams is a proprietary business communication platform developed by Microsoft as part of the Microsoft 365 family of products. Teams primarily competes with the similar service known as Slack. They both offer workspace chat and video conferencing, file storage, and application integration. Teams is replacing other Microsoft operated business messaging and collaboration platforms. This includes Skype for Business and Microsoft Classrooms. Throughout the COVID-19 pandemic, Teams and other software such as Zoom and Google Meet gained much interest as many meetings moved to a virtual environment. As of 2022, it has about 270 million monthly users. Microsoft Teams features make it stand out from other collaboration software such as online video calling and screen sharing. This allows us to have fast video calls to employees within their business or clients. It also has desktop sharing for technical assistance and multi-user real-time collaboration. Secondly, teams and channels. Teams are made up of channels which are conversation bots between teammates. Thirdly is telephone replacement. Teams supports connectivity to the public via switch telephone network, which is a telephone system called calls, which allows users to use Teams as if it were a telephone with a number people can call and be able to call numbers. Fourthly is meetings. Meetings can also be scheduled or created, and users visiting the channel will be able to see that a meeting is currently in progress at the same time. And fifth is Teams Live Events. Teams Live Events replaces Skype meeting broadcast with the ability for users to broadcast to 10,000 participants on Teams. Sixth is breakout rooms. Breakout rooms allows users to split a meeting into small groups. Users can activate this feature during or before a meeting. Seventh is front row. This allows participants to adjust the layout of the meeting, putting the speaker or content in the center of the gallery with the participant video feed at the bottom. Finally is education. Microsoft Teams allows teachers to distribute, provide feedback, and grade students' assignment, which is turned in via Teams using the assignment tab. Now, why should your business use Microsoft Teams? When it comes down to it, business should use Microsoft Teams because it is extremely user friendly and can facilitate a work environment between remote users or within a large business. Projects, productions, and other business elements can benefit from Microsoft Teams as well. Now, let's take a look at Microsoft Teams history. Microsoft announced Teams at an event in New York and launched the service worldwide on March 14, 2017. It was created during an internal hackathon at the company headquarters and is currently led by Microsoft Corporate Vice President Brian McDonald. On May 3rd, 2017, Microsoft announced Microsoft Teams would replace Microsoft Classroom in Office 365 Education. On July 12, 2018, Microsoft announced a free version of Microsoft Teams, offering most of the platform's communication options for no charge, but limiting the numbers of users and team file storage capacity.
So let's talk about how does it work. Basically, the Microsoft Teams has many features that helps the healthcare system to improve work. These features include storing files, making calls, chattings and also arranging meetings as well. With adoptions of Microsoft Teams, organizations have been able to foster the connections at a time where physical distancing was a necessity. In healthcare system, teams help in improving the workflow and benefits patients and also physicians by helping them to connect with each other. They help by storing patients' medical history, virtual consult with team, collaborate with meetings and also simplifying administrative workflow as well. In the point of storing patient's history, the patient's medical history and all their details will be saved in Teams files, which helps the other patients or the other surgeons to go through it at a time. As for the virtual consult with team, it helps the health practitioners to bring together the audio and the video as well. The third point is collaborate with meetings. In this, doctors can actually conduct an audio or a video meeting across a range of a device where patients and doctors can be connected as well. The fourth point is simplifying administrative workflow. It enables us to share announcements across the organization to keep everyone updated on an important event or an information. The Microsoft Teams actually helps the medical practitioners and physicians by allowing them to do a virtual rounding as well. What is the meaning of virtual rounding? Virtual rounding is It's a type of patient care where the physicians actually go rounding and see and check all the patients. But in this case, they just do this virtual rounding via the teams as well. They can ask questions and gets the answer by the teams as well. Rounding is actually a critical patient care. It gives the medical students and clinicians for a better experience in their learning and knowledge. In this pandemic of COVID-19, it was really helpful for the physicians by using the teams to do a virtual rounding.
Hello everyone, I'm Darshni, and now let us look onto the roles of Microsoft Teams in a healthcare organization. There are a few important roles that Microsoft Teams play in a healthcare organization. For example, having virtual appointments and electronic healthcare record integration. Second, Teams policy packages. Third, secure messaging. Fourth, care coordination and collaboration. And last, Teams template for healthcare organization. Now let us look further into what is meant by virtual appointments and electronic healthcare record EHR integration. So with the use of Microsoft Teams electronic health record EHR connector, the physician can be able to quickly start a team session with their patient for a virtual patient appointment or even have a consultation with another healthcare professional to discuss about their patient's condition. And the patient can also use this Microsoft Booking app, which is a feature available in the Microsoft Teams itself, to if their EHR is not supported. However, there are differences between EHR Teams integration and Microsoft Teams Booking that the patient may encounter while using Microsoft Teams Booking. So through Teams EHR integration, the staffs can be able to schedule in patient's EHR, and the patient can also request appointments through patient portal. However, through Microsoft Teams booking, the staff can schedule from booking apps itself, while the patient can request for appointments in the booking app. And through Teams EHR integration, the visits can be started from the patient's EHR, while in Microsoft Teams booking, the visits can be started from Microsoft Teams itself. And lastly, the visits runs as usual meetings in Teams in patient's EHR with the functionality of Teams in the EHR Teams integration, while in Microsoft Teams booking, the visits runs as a meeting in Teams with all the Teams functionality. Next, we look onto care coordination and collaboration, which is one of the vital role of Microsoft Teams in a healthcare organization. So the team's integrated collaboration features allows doctors, clinicians, and nurses and other healthcare workers to work together effectively through Microsoft Teams. And this can be done by organizing information of the workers and health teams into teams and channels available in the Microsoft Teams. And secondly, they can even chat, send messages, and communicate with the medical staff about the patient who require treatment and attention. Third, they can have regular calls and meetings with medical teams. Fourth, they can have their information, files, and documents stored and shared with their fellow team workers. And fifth, they can share lists and track information of their medical records. Sixth, they can track the task of their workers and supervise their daily activities. Seventh, they can approve the streamline of their appointments and whatever online meetings they have. And last but not the least, they can even create, control, and distribute the schedules of patients' appointments or their medical records. Through Microsoft Teams, secure messages can also be guaranteed. And Microsoft Teams gives high assurance that the messages sent by the healthcare workers to patient is well received and read. And they can even monitor rapid patient and clinical attention to important updates in the Microsoft Teams and enable the development of brand new healthcare teams for each patient. Next, they can even provide Teams policy packaging where they can apply Teams policy package to specify the capabilities of various Teams roles. Last but not the least, they can even create Teams template for the healthcare organization. Templates can be made especially for healthcare organization that simplifies the formation of teams that allows the workers to communicate and work together on patient care or operational requirements. Now we are moving on to the advantages of using Microsoft Teams. Microsoft Teams is easily implemented. It is a user-friendly and a cloud-based app which makes the processing power vast. The information can be accessible to the team members on any devices and from any location. Apart from that, it also enhances the work focus of fellow workers. By having a conversation through Teams, it saves times compared to sending and receiving emails back and forth by using the old method. The channel can also be divided up for important message and organized in a way that the workers will not get confused using them. Last but not the least, Microsoft Teams also improve the team's productivity due to the single interface to manage all communication, since everything that is available in the Teams will be at the fingertip of the workers. Now, let us look onto the disadvantages of using Microsoft Teams. Microsoft Teams has a very limited flexibility, the lack of adaptability in repeating the structure. For example, whenever a user have to create a new channel or a group, they have to start everything from the scratch. Since Microsoft Teams will not allow a person to duplicate a team or transfer a channel from whatever they've done in the past, which make the user to waste their time in doing everything from scratch all over again. Next, Microsoft Teams have a very discrete file structures. As the files in this root folder are reorganized and moved around, connections from the Teams chat to the file may become broken, which causes the user to have hassle in searching whatever the files they wanted at the moment. Last but not the least, Microsoft Teams have a very different experiences with online meetings. It is even clumsier than group calls app like Zoom, Google Meet, and even WhatsApp, which makes it harder for some users to adapt.
Hi everyone, I'm Yin. So I'm going to talk about the new features of Microsoft Teams. So due to the COVID pandemic, we have started to use the internet to conduct variable activity remotely to avoid the risk of infections. However, when we use the internet to deal with various medical problems, we find that there are many shortcomings. So the Microsoft team has developed new feature. So first, enable patients to request appointments with their provider in team. So this organization using this feature will be able to monitor on-demand appointment in a queue view through the Microsoft Booking apps in Teams. So this will help the patients if there are any confusing or any questions. There are no need to special take leave and walk in to enquiry. So next, the technology giant completes its acquisitions of news communication. This is a provider of speech recognition service and conversation artificial intelligence across industry. Of course, they are included healthcare. So this service will help many elderly patients express their needs. So next, enable the collections of patient triage information in team. And next, able access to analytic insights regarding virtual visit performance in the Microsoft Teams Admin Center, including insights on metrics like lobby waiting times and the impact of times-based notifications. This will not leave a lot of time for the patients and does not waiting in the hospital to avoid increase the risk of infection. Lastly, the company also announced a collaboration to integrate Solo and Teams with the aim of streamlining the technology and administrating processes involved in virtual care. Through the integrations, clinicians are able to securely access EHR clinical data while teledoc health solo within the Teams environment. Thank you.
In conclusion, Microsoft Teams actually helps healthcare system. They play an important role by helping the clinicians and physicians to connect with their patients. Teams plays a central role in a broad portfolio of new clinical continuity solutions. Microsoft Teams was actually designed to help millions of people and also benefited many of them. And of course, it really helps the healthcare system in many ways. It gave a big relief for the frontliners to minimize their time and energy. Most of the features in Teams were easily accessible and created a good communication between the physicians, the surgeons, and also the patients as well. So in this pandemic, it really helps the physician to have more virtual connections than the physical ones.